Thank you for joining us for Kremta News at 10 tonight. I'm Mark Hanrahan. For the second year in a row, Hoopfest is canceled. That call came late this afternoon. The reason? Growing COVID cases and hospitalizations all across the inland Northwest. Hoopfest says that decision is excruciatingly difficult, but was made after numerous discussions with the governor's office and the Washington State Department of Health. Multicare, which partners with Hoopfest, also says it's in the best interest of the community to cancel the tournament. Earlier this evening, we talked with Hoopfest Executive Director Matt Santangelo about the event's cancellation. Brandon Green joining us now from the newsroom with more on what he had to say.
Yeah, you could tell this was a very emotional decision for Santangelo today, but there was just no way around it.
It hurts my heart. My heart is hurt is how I feel.
The decision to cancel Hoopfest came heavy and fast.
48 hours ago, we were a go. And then just this morning, as we continue these conversations with, regional health professionals, even at the state level, we realized that it was no longer a go.
Stopping the event, though, doesn't just impact people who participate or work for Hoopfest.
You feel like you let so many people down. Hoopfest is such a treasure. It's such a gem for the region, from basketball playing, from connection and love from the volunteers, from the support of sponsors, and ultimately like the economic impact to the region. It has such a great and far-reaching impact.
For teams, they have the option of donating their registration fees or getting a 20% refund. Santangelo realizes that this is not an ideal situation for participants, but it's also not an ideal situation for his organization.
It still puts us on shaky ground as a small business that did not have its primary business activity available to us for 2 years. And so that really is the reason behind the refund policy, is because not only have we not had the ability to have our own event, but also the amount of expense that we've incurred in planning for 2 weeks from now for Hoopfest 2021.
Santangelo now can only try to move forward to Hoopfest 2022 and hope and pray that next year has a better outcome.
But at the end of the day, you're doing the right thing, but it doesn't make the decision any easier. It is hard, and my heart's really heavy at the moment.
Hoopfest 2022 is slated to take place on June 25th and 26th. We will go 3 full years without a traditional Hoopfest event here in Spokane. Back to you.
Brenda, thank you very much. And a lot of people who registered for the event are probably wondering, what now? So here's what you need to know. Registered teams have a choice now between donating your registration fees or requesting a partial 20% refund. Santangelo says the reason for that partial refund is because the decision to cancel the event did not happen until today, 2 weeks out from the event. Team captains will be receiving an email to determine donation or refund status. Requested refunds will be processed by September 30th. What teams will be receiving still includes Hoopfest 2021 official player shirts, and team captains will also receive a Hoopfest basketball. Now, we understand this is all a lot of information, so for the latest on all things Hoopfest and the event being canceled, just text the word Hoopfest to 509-448-2000. The coronavirus continues to explode in North Idaho as well. The current surge has set a record now. 96 people currently hospitalized with COVID just at Kootenai Health alone, and that is forcing the hospital to take some pretty drastic action. KREM 2's Casey Decker was in Coeur d'Alene today with exactly what they are doing.
Well, what they're doing is turning basically an office building that is not meant to treat patients into a sort of overflow COVID wing. This building right here is usually home to classrooms and conference rooms, but right now it's home to 22 COVID beds. The Delta variant of the coronavirus isn't just more transmissible, it's also more dangerous and deadly.
Even the healthy, younger, no comorbidity patients, we're seeing those become sick enough to become hospitalized. In fact, in just this last week, in a 36-hour period, we had 3 patients under age 45 die who did not have comorbidities.
Hospitalizations are skyrocketing. Kootenai Health currently has 96 COVID patients, 34 in critical care. That surpasses the previous record of 91. And furthermore, that record was achieved during a wave that took a few months to peak. The current number was reached in a matter of weeks and with no end in sight. And Kootenai Health's chief physician, Dr. Karen Cabell, says even though the data doesn't reflect it right now, the death toll from this wave will be high.
We're seeing a very high mortality rate as well. But the reality is that most of these patients that come in, they're often in the hospital 2, 3, 4, 5 weeks before they die. And so we're just at the very beginning stages.
On top of the low capacity, they're also low on staff.
Many of the frontline nurses and physicians that are helping care for these patients are working very long hours and doing a lot of overtime. The team is very tired.
That means the entire hospital is stretched thin.
We have many patients that need services for things like car accidents, other types of infections, other health issues, and we're really struggling to find capacity for them because at this point, half of our baseline bed capacity is being devoted to COVID.
The first step to dealing with this surge was doubling up patients in existing COVID units. But every day there are way more admissions than there are discharges. So now they're taking the second step and creating a makeshift COVID wing out of an office building on site.
This is a space that we fit up for 22 beds. The rest of this space will vacate because you don't want to commingle different types of occupants.
What was classrooms and conference rooms is now clinical space. Carpets were ripped up, rental beds brought in. They even had to purchase hand washing stations because the rooms don't have enough sinks. There are no patients here yet, but hospital leaders are already preparing for what they might have to do if this space also fills up.
Beyond that, we'll continue to explore whether we need to do other field hospitals, buildings, tents, or how we may access additional beds throughout the community and the other hospitals.
And an important point here, nearly all of the patients in the hospital with COVID are unvaccinated. The few who are vaccinated, I'm told they had various sorts of immune system issues that made the vaccine less effective for them in particular. Reporting in Coeur d'Alene tonight, Casey Decker, Crime 2 News.
And with the surge of COVID patients, Kootenai Health now preparing to transition to what is called crisis standards of care. That means there's a possibility that not every patient will get the care they need. The state coronavirus task force is the only one with the authority to authorize crisis standards of care. It's never happened before throughout this entire pandemic. So that would give you an indication of just how severe the situation really is in North Idaho right now. It's intended to be used only when hospitals are so overwhelmed by patients or resources are just so scarce, it is no longer possible to provide all patients the level of care they would receive under normal circumstances. The goal is simply to extend care to as many patients as possible and save as many lives as possible. For more updates on COVID numbers and hospitalizations, just text the word COVID to 509-448-2000. Well, statewide this past month, Washington also seen a surge in COVID hospitalizations, with experts there saying hospitals are at the highest level of occupancy the state has ever seen. Let's take a look at the numbers. 1,463 COVID-19 patients currently in care right now. In the past 30 days, there have been more than 1,100 people hospitalized. That's an increase of 200 since last week alone. From February 1st to August 3rd, 94.5% of COVID-19 cases in the hospital were from unvaccinated patients. In Spokane County, meantime, health officials reporting 230 new COVID cases today. One new death was also reported, and 197 patients are currently hospitalized due to the virus. As school is about to begin, Spokane County's vaccination rates for kids from 12 to 17 years old still lags behind the rest of the state. Spokane Regional Health District says almost 35% of children in Spokane County in that age group, 12 to 17, have gotten at least their first shot. 28% are fully vaccinated. Statewide, the numbers are much higher. 50% of kids 12 to 18 have received their first shot, and nearly 42% are fully vaccinated. We understand this is also a lot of information. So for the latest on the local COVID numbers, hospitalizations, and vaccine requirements, just text COVID to 509-448-2000.
With that being said, this is now over. We convene 5 minutes versus you guys are lame.
It was an explosive start to the Spokane Public Schools Board meeting tonight. That was Board President Jarrell Haynes ending the in-person meeting when protesters refused to put on their masks. Those protesters say they are opposed to mask mandates in schools. Crime 2's Morgan Trow has been following this issue for us all week long. She is live in the newsroom tonight with more from tonight's meeting. Morgan?
Mark, Jarrell Haynes ended the meeting after less than 2 minutes. That must be record-breaking time. I actually spoke to him one-on-one before the meeting, where he says anti-maskers will not take over his time. Spokane Public Schools has one final board meeting before thousands of students return to campus. On the agenda was reopening information, discussions of the budget, and equity policies. But anti-mask and vaccine protests disrupting SPS and other school district meetings have been happening for weeks now, and we're threatening tonight's important meeting.
If everyone's not willing to abide by that, then we'll find another way to have our meeting and get our jobs done.
And board president Jarrell Haynes did exactly that. He says he knew tonight was going to be intense. He saw the Central Valley School Board struggle to maintain control over their meeting earlier this week. After just 30 minutes, the Central Valley Board had to stop the meeting due to protesters refusing to wear a mask and being disruptive. But tonight, he was prepared, and he had the time.
Do any of you plan on wearing your mask this evening? No. Okay. With that being said, this is now over. We convene 5 minutes versus you guys are lame.
As quickly as the meeting started, it finished. With the extensive amount of material on the agenda, Haynes kicked out the protesters and switched to an online-only meeting. He also adds that the board, of course, wants to hear from the community, but respect needs to be given to the board and to the Department of Health's guidance.
It's very personal for them, right? People are talking about, so oftentimes, some very real hurt and pain that they themselves may be experiencing. So just really leaning in and trying to truly understand where they're coming from, their perspective, and the experiences that they may have.
During the online public comment, the majority of people were extremely complimentary of the mask mandate, especially students. Haynes noted that many of the anti-maskers that attended the SPS meetings don't live in District 81. While I have been attending these protests for the past few weeks, the majority of people tell me they attend rallies at all different schools, bouncing from district to district. In the newsroom tonight, Morgan Traub, Crime 2 News.
Morgan, thank you very much. After being closed for more than 530 days, the Knitting Factory is reopening. Today, the concert venue reopened and is set to have bands perform later this year. Some of those bands include Modest Mouse, The Districts, and Smells Like Nirvana, which is a Nirvana tribute band. The venue says they will be following the statewide mask mandate, which requires masks to be worn regardless of vaccination status. All right, let's take a pause from the headlines for a moment to talk weather because, my goodness, today was pretty fantastic out there. Let's get straight to meteorologist Thomas Patrick at the Outdoor Weather Center. Thomas, if I'm being honest, it's nice just to enjoy comfortable weather again, right?
Yeah, fantastic today, fantastic yesterday, right?
Oh, amen to that, yes.
And the day before that. In fact, this whole week has been fantastic weather, a little cool in the evening hours and first thing in the morning. Still been plenty warm during the daytime as our temperatures have this week largely topped out in the 70s and even 80s at time. Right now we got 66 at the moment. The winds have been under control. They might have been up to 15 miles per hour today and could do the same thing for tomorrow. But if that's the most extreme weather that we're going to see for this week, I think this is going to be a really nice one for the area. So there we go into the mid 50s this time for this evening. So not as cold as it has been in some previous mornings as we've seen across the area, but we are still under this little bit of a trough, which has kept things at least temperate. Not necessarily too cold, but at least definitely far away from hot. But as we get on the other side of that jet stream wave, temperatures will once again increase. Looking at mid 80s for this upcoming Sunday, and coming up detailing just how long we're going to see this slight uptick in terms of temperatures.
All right, Thomas, sounds good. Thank you very much. And still ahead tonight, if you got the Johnson & Johnson vaccine, will a booster shot be available or recommended from you? A lot of you have been asking us, so we'll have an update on that when we come back after the break. Plus, a new addition to Riverfront Park that will replace a previous sculpture that got knocked down by wind. An update on that butterfly in Riverfront Park still ahead.